Hello to all my friends from Uganda. This is Dr. Rossopoulos. I'm speaking to you from Los Angeles, California, and I'm looking forward to spend the next 30 minutes or so with you discussing a very, very dear subject to me, the subject of digital dentures. I'm wearing my Ugandan shirt, which I have custom made in Kabale a year ago. And I'm going to try to share my screen and start this presentation. Um, so let's see here. We're going to display settings, duplicate, and let's get started. We're going to be talking today about digital denture in removable prosthodontics. A very, very, very hot topic lately associated with making dentures with a CAD/CAM technology. A little bit about myself. I come from the city of Thessaloniki in Greece. Thessaloniki is a pretty old town. It's been very popular for many, many years. This is the old town, as you can see here, and the new town, which is built with the high-rise buildings. And right there where you see this cylindrical building, that is actually the dental school where I graduated dentistry. Thessaloniki is on the northern part of Greece at the Aegean Sea by the water. And to give you a little geography on this, it sits about that area. And if you take the same longitude, the vertical line that goes through the earth, we are actually very close to Uganda. I was born and raised in Thessaloniki. This is the dental school again. I did my graduate training at Eastman Dental Center, and now I'm practicing in this building in Southern California. This is Huntington Beach, where I live. And California, for those of you that don't know, is in the southwest part of the United States. And this is my second home. My second home is actually Kabale, Uganda. We visit there every year on an outreach program with the Build Your Smile Dental Foundation. And I'm very glad that they put up the Greek flag every time we come to visit. My mentors are people that had a great effect in my professional and career and in my life, such as Dr. Kafandaris, Dr. Handelman, Dr. Brewer, Dr. Jarvis, and my chairman, Dr. Grazer. This is myself many, many years ago as a first-year resident at Eastman Dental Center. Before we start to even touching the subject of digital dentures, it's a good idea to look into a dendulism as a total. So when we talk about a dendulism, we're talking about the loss of somebody's natural teeth. This has become a very important public health issue globally, not only in the United States and the Western countries, but also in Africa, in Asia. It's a global phenomenon. It has a very high prevalence and very, very high disability associated. And you have to realize that in the United States, even in the United States, one of the most advanced countries, those that are 50 years of older, they are 10% of them will be a dentist. 20% of them that are more than 60 years will be a dentist. And this phenomenon or this public health issue does not only relate to age, it also relates or finances. So many people that they are below the poverty level are without teeth, and there are reasons for that. The other thing we need to look is there demand for dentures. As I stated, dendulism affects the most vulnerable populations, the aging and the economically disadvantaged. In the geriatric population, about 23 million of them are completely edentulous. I'm talking about the United States. And about 12 million people are edentulous in one arch. 90% of edentulous patients do have dentures, but there's also 10% of them that they do not have dentures. The number of partially denture patients, we anticipate that it will continue to increase over the next 15 years. So why is it important? Because if somebody is missing their teeth, we have significant changes in their nutrition, obesity, their diabetes. We even see a lot of coronary artery disease and even sleep apnea. There are a lot of studies done lately that they relate edentulism to sleep apnea. The other thing that is very important, why removable prosthodontics or denture prosthodontics is important to us, because all the basis for implant rehabilitation, for rehabilitation of any kind of oral environment, we start with removable prosthodontics, and that's the basis of it. If we look into the dental market, it seems like the adult population in need of complete dentures will increase over the next several years. There will be a decline in removable patients, but this will be offset by the increase of adult population. So the bottom line is we will have many people that they will require both full or partial removable dentures. One of the issues that we also have seen lately is the lack of focus on actually the removable prosthodontic education, at least in the United States. There is a lack of studies to clearly evaluate removable prosthodontics or dentures, and the curriculum has really reduced to the minimum. 16% of the students that they graduate at dental school in the US, they have not even completed one set of complete dentures. It's not required. And we see a decrease in the number of cases treated by the dental students. So our graduates, as they graduate dental school, they are not adequately equipped in complete denture therapy. There is a reason for that. There is a lot of improvement and a lot of involvement now with either CAD/CAM fixed prosthodontics or with implants. So something had to give in the curriculum, and I think what it gave was the field of removable prosthodontics. One other thing we are looking at is that our profession is in general abandoning this area of practice. We have a personal negative bias towards removable prosthodontics. Fixed prosthodontics and implants are actually more sexy, if I can put it that way. So people or dentists are more interested in using other treatment modes to meet a patient's need other than dentures or removable prosthodontics. Let's consider a few more points. Our goal as dentists or dental professionals will be to reduce the total endentulism with advances in preventive and restorative procedures. It makes sense. If we can cut down the rate of endentulism, we actually provided a very good service. Finances and the high cost of expensive implant prosthesis or fixed restorations might play a role as we look into the future. And without an ongoing comprehensive understanding of removable prosthodontics, the profession's ability to meet the needs of the edentulous older patients will be compromised. And not only when they deal with them by making them dentures, but also when they deal with them by providing them with implants or other prostheses. And there will be patients that actually full dentures are indicated instead of other. People cannot have implants, or there are other reasons that full dentures is the indication for that particular patient. And we have to reflect on that patient's need and actually strive into providing very high quality denture therapy to those patients the same way as we try to provide very high quality treatment in other aspects of dentistry. So saying that, and this is the little background information, let's enter the beautiful, as I call it, world of digital dentures. This picture is actually taken in Jaipur, in India, and this is the famous Jaipur dentist that is outside the train station there, and they can make you a denture by using these templates and relying them with soft acrylic. They are there every day, and they create their shop on the sidewalk, and they treat patients. Let's look. The most advanced CAD/CAM technology and the most popular at this time relates to actually crowns or bridges. And this CAD/CAM technology, if I can put it in a nutshell, it involves scanning the prepared tooth, designing, as you can see here, the tooth on a screen in the computer, and then mill it and manufacturing. And the same exactly workflow applies to when it comes to dentures. There is a little difference that we actually at this time do not scan the patient intraorally. We do make an analog impression by border molding and making a correct denture impression. And then we use a desktop scanner to actually transfer our impression, our analog impression, to a digital form. And then we go the same thing as with a crown and bridge. We do design and set up the teeth using a specific software so that they're meant for that. And then we are using a milling machine to actually fabricate the denture. So the workflow with fixed and removable prosthodontics, it's actually the same in concept and in a nutshell. Let's look at one of the original workflows, or how we took care of this particular patient. So this is a upper maxillary and mandibular lower impressions, final impressions for an upper and lower dentures. There are also those two, to your right side, two templates or two trays, which we relined in the mouth, and using a certain technique called the Gothic arch tracing, we are able to create the bite registration for that patient. We are using this template to give our software the opportunity to know where the teeth will be set and where the midline and the incisal edge will be. We use this ruler to give the information on our occlusal plane, and then everything, as I told you before, is scanned, and it becomes now from an impression that we had into a digital image, as you can see here. This is those impressions that now are becoming a computer image. So those are articulated virtually with this software. And with the help of the software, we can set up the denture teeth as you see here. So if I can explain this to you, this is the base. Our impression will determine the intaglio, or the inside surface of the denture, upper and lower, put together in the position that our bite determined. And then the teeth are set this way. And then the next thing after this setup is done, as you can see here, it will be the milling from a milling machine of the denture base, and the teeth will be lued into place. So this is a final milled denture, and the teeth luted onto this. And this is the final appearance of that particular patient. This is my first digital denture that I made back 10 years ago. Are there some flaws? Yes, there are, but overall, pretty good result for actually a 2-visit denture. Not trying in this situation. And this is how our laboratory looks now. We're making the impression, then we take it here, scan it, and we design it. And then we actually outsource, send out to a laboratory to mill it. We could have that in the office. We elect not to. So here's the digital workflow. When it comes to digital denture, we're making our impressions and records. Those become digital records with the help of the desktop scanner or actually an intraoral scanner. We will design the denture, we will fabricate it, and then we will deliver it. Here's how the digital records are made. You can actually use an intraoral scanner to make your digital impression, or as I showed you before, you can make your impression and use this scanner, which is called a desktop scanner. And you have the ability to have this equipment in your office, or you have the ability to send your impression to a laboratory that has this equipment, and they can digitize it and proceed from there. Here is a clinical example. So this is again an intraoral scanner, and this is a scan of an edentulous jaw. This is a final impression of a edentulous jaw that we made at the office. Using this desktop scanner, we scan it, and this became this image now, which we can manipulate with the software in our computer. Here is my assistant that does actually the scanning. So I make the impressions, and then Gisela takes it over, and she is able to do all this scanning. The next step is what we call a digital design. There are software programs that you can actually set up or do a virtual teeth setup. And you can do that yourself, or you can send it to a laboratory or to a company that just does these designs. There are many programs that you can use to do this digital design of denture. Each has advantages and disadvantages. Here is an example of a full upper denture with an immediate lower denture we're going to be making. The beauty of this is where you see blue is the existing denture. So this can give us some guidance on where we can set white teeth, the new denture. So the setup, as you can see here, is the white teeth. The blue is the old denture. So by using in the guideline of where the old teeth were, we set the teeth in the same position, or we make changes as we wish. Same with the lower. Those teeth are removed virtually from this image, and this become a full lower denture now. We set up those according to the upper. This is how the set looks. It's a 3-dimensional, so I can take it and move it around and play with it. And if you want to see the sides, this is the side view, or the beauty of it is the back view, because you can determine where your back teeth will be set according to that. And the fabrication, same thing, you can outsource it. And there are milling machines that you can mill a denture, or there are printing machines that now we actually can print a denture. Let's take a couple of quick clinical examples. We use, for those that they have dentures, a duplicate denture technique. That means we very inexpensively duplicate with acrylic the patient's denture, and we use that denture as a template to make the final impressions, as you can see here. So duplicate denture with relief, border molding, cut the, we modify that border molding, and then we make a wash. And then similar with the lower. So that's the final lower impression. And as I told you before, we take those and we already have where the teeth are. In this case, we want for this particular patient to move the midline, so we can make a groove here and show the software where we want the midline now. We make a bite registration. And the next step is that this is actually digitized. It becomes now a virtual image, exactly as you can see here. From here, we go through teeth setup in a way. And this is our final dentures for this particular lady. The beauty again is that this happens in 2 visits. Here's the certain milling machine. Again, we do not have that in-house at the office. We could, if we want to spend the money and buy it. It mills the denture, and then the denture teeth are luted on it. Here you see another image of this milling machine and this pre-made pack of acrylic or block of acrylic that it's milled upon. We can also take the patient's denture, reline those, and use that as our final impression. If we have the scanner in the office, we can do that. This is actually a tissue conditioner that we used in this particular patient. Digitize it, as I showed you before, as you can see here. And then here are the final dentures for this gentleman. This is actually an implant overdenture, as you can see here. And those are the 2, what we call locator abutments, that they are abutments that are screwed into the implant. And then the inside of the denture, we have the female plastic part and the 2 snap together. For elderly patients, sometimes it's hard to remove, so we put 2 little wings on the side for them to be able to put their fingers underneath and push that denture up. Another example of using the patient's existing denture, as you can see here. This, we need to increase the vertical, so we made a bite at an open vertical, if I might put it that way, as you can see here. And then this now is milled from a single block. So after the design or the virtual setup is done, then the pack, or then this pack is made. That also has not only pink gingiva acrylic, but tooth color acrylic into it exactly in the position. And this is milled as 1 piece. So this becomes an 1-piece denture and not individual teeth luted in this. And here's the final one. In the mouth, some occlusal adjustments were needed, but very good fit on this because you don't have any changes during the acrylic processing. It's a milled. And for those that they don't have dentures, such as this gentleman, and you can see the upper and lower jaw, we use those trays. They are called good fit trays, and all they are impression trays that they have teeth on it. So by manipulating this, we are able to do an upper and a lower impression, and also have teeth on that to show us where the teeth set up. So we actually position this, the denture, in an area that looks good. This is digitizing it now. This is the virtual image of it, and the final dentures for this particular patient, 2 visits. Okay, very good occlusion on them too. And not too many adjustments are needed. Here's this gentleman again, got his dentures in 2 visits. We also use the technology for immediate dentures, such as this, failing upper and lower dentition. The patient did not want to do anything for the lower at this time. So we make our impression. We use block out PVS material. We make an alginate, and then we flick this out and position it back to the alginate so we can get a good detail on this. This we pour a cast, so it involves some more laboratory work, and we digitize the cast. So we pour the cast, and then we digitize it. And then this is the patient's final denture, did not like the color, so we made a quick wash on it. New denture was made, and now she's happy. But you can see she wanted to exactly match how her teeth with it and just get an idea on where the cuspid over extrude. We were able to duplicate it almost the same as before. We had very good success in our practice with the digital dentures, almost an 80 to 85% success rate with those patients. Excuse me. And there are other companies other than the one I show you. It's made by the Avaden company. That's the technology we are personally using at the office. Excuse me. This is by Glidewell Laboratories. This is the Baltic denture. That's a prefabricated pack with teeth, and then that is milled. It's a beautiful looking denture, but it doesn't give you the opportunity to visually set up the teeth. They are preset. It's a template. Dentsply has a very nice system also. Vita, there are many companies now involved with it. This is a beautiful product called Ivotion, made by Ivoclar, that we're able to get very, very nice results on it. And it's hopping as far as digital dentures. There are several Facebook pages. Um, so you understand that this is a popular subject now, and it keeps evolving. A little bit about 3D printing. I talked to you about milling. Now, 3D printing is very similar. Instead of at the end you're going to mill, you're actually going to print the denture. The original full denture printing was done with a monoblock tooth color. So this is a printed denture, and then surface stain the pink acrylic. Not looking very good, but that was the original. And then we started printing actually, this is several printers in the market, from the low end to the very high end. They can go from $3,000 to $250,000 printers. The printing technology, it's three ways. The SLA, the DLP, and the SLS, SLM. It's very easy to read about it if you're interested. I don't want to bore you about it. And those are some lower price printers on the market, medium priced, and high priced. This printer actually is one that prints multicolor, and that's where the future will be. So we were able to put several colors on the printer. This is a prototype, so it doesn't look as good, but it has a little bit of translucency, a little bit of yellow to it, and then the pink also different hues. Those are all different colors that they're printed in this printer. Those are on the area of $250,000 to $300,000. So it's not doable for dentistry yet. And then we have several materials. When we print the denture, we actually print two separate prints. One is the pink acrylic, the gingiva hue, and the other is the denture teeth acrylic. And of course, materials come, the denture 3D is the pink, and the crown and bridge is the tooth color, and the two are luted together. So we have to do two separate prints. Where I think we're going in the future with this, socioeconomic factors will play a role. So for a patient that cannot afford expensive implant treatment, dentures will be it. I think CAD/CAM technology will completely replace the traditional way of making dentures. And 3D printing, when it becomes stronger and better, it will actually replace even the milling. At this time, milling is a better quality denture. There is no doubt about it. We were going to be able to do one visit dentures by having all this in our office. And in many instances, we will be able to do it yourself dentures sometimes for those patients. It might hit the market. We have to improve the curriculum in our schools. We have continued to improve the technology. There will be enough dentures to keep us busy. And this is going to be an evolution. So this will keep evolving more and more and more. I would like to finish with one thought that the digital denture systems will evolve to be popular and superior for the benefit of our dental patients. However, our focus should be in actually tooth loss prevention. Our primary goal will be to save the teeth and not take them out and then making them dentures. And with this, I would like to um, say thank you. This is Thank You in Greece. This is Dr. Barzilay and myself up in the North Pole saying thank you to all of you. And it was a great, great pleasure being with you and looking forward to next year being back to my second home and see my great, beautiful friends, the Ugandan people, people that I know and I don't know, and go to the villages and treat and help the people of Uganda improve their oral health. Thank you for staying with me. We're going to be answering questions and looking forward to see everybody again next year.